So just for our audience at home, yeah, I'm talking to you. It's the last week of May. Things are starting to open back up after the COVID-19 coronavirus pandemic, or I say after, but it's still ongoing. So as you know, practices are starting to reopen and to be able to see their patients in person. What can physicians do to integrate telehealth with their in-person practice?
Yeah, absolutely. And I think it's very important for the practices to really take time to think through telehealth and how they want to use it for the different patient populations they serve and for the different conditions they treat. For some conditions, it's very easy to really maintain a lot of the telehealth is kind of the primary source for that care. So if somebody's got a cold, flu, kind of well check, there's some of those aspects where you can maintain behavioral health is another one where you're really having a conversation. It doesn't matter what location you're in. Some of those things I think will really stick around, assuming payers don't change the ability to get paid at very similar rates if you're doing it by video versus in person. So I think thinking about segmenting your population and how it's going to work is very key. For other patients where you really need to bring them in for testing or the physician needs to have that direct interaction, certain specialties, particularly surgical ones like ophthalmology, orthopedics, there's only so much that you're able to do via remote imaging or sending the patient for imaging. You may still need to see how is the knee moving and how might you approach the surgical care. So I think understanding what your populations are, understanding what conditions you can use telehealth for and other ones where you may need to actually bring the patient in is very important. But even for the surgical specialties, there's a way to be able to do some of the physician to patient interaction remotely. So it might be you could do the post-op visit as a telehealth. You don't get paid for that anyway right now. You never did. And so they could use that as post-op versus having to have that patient come back on site. The other thing to look at outside of just the actual billable component is to really think about the pieces of care that could be done before the patient comes into the clinic or into the facility. So that could be things like doing a preoperative assessment for healthy patients, having the nurse or the CRNA or nurse practitioner call the patient, talk to them about their medical history, go through those screening questions. Those kinds of things are already happening in telehealth form, either via phone visit or now could be video, but also being able to take part of perhaps the workup for the examination prior to when the physician would have seen the patient and do the medical history, going through the patient's kind of medication reconciliation. A lot of those things can take, sometimes 10, 15, 20 minutes of a certified medical assistant or nurse's time. And now with all the social distancing requirements that the practices are having to deal with and the added disinfection processes they're having to put in place too, being able to get the patient, some of those activities moved off-site and upstream can be really important so that you don't have the patient in your facility any longer than necessary, which means ultimately you're going to be able to have a higher volume kind of in your practice than you would if you brought everybody in for that entire continuity of care or piece of care. So those are things for them to really think about. Additionally, telehealth really provides some flexibility for providers. If they're doing video visits, they could offer extended hours for patients. They could really, in some ways, create their own schedule, kind of keeping in mind how their patient population really wants to interact with them. And so this would be something that would be really important too. So thinking through those pieces in advance and really thinking about each patient population, each disease condition differently would really be helpful.